thank you for being with us, and all of you for being with us. I understand you're under a time constraint, and we appreciate that, and we will honor that. So if you could please begin.
Sure. Well, as you said, I think in your email invitation, you mentioned that we've talked regularly. We spoke yesterday, so I won't go over numbers. I think there were 2 points that for clarification. One, yes, the order for face coverings are actually consumer and employee protection, as I don't want to focus just on face coverings because there's actually many more items in there that I think will offer more protection for employees and consumers. That went into effect yesterday. And that included a number of provisions requiring face coverings for customers and employees, and requiring employers to make provisions or provide those face coverings to their employees, as well as making sure that they follow sanitation guidelines and put in allowances for workers to wash their hands, and other factors to mitigate transmission. The feedback has been positive so far. We do recognize that there's some people who are not happy about it, in terms of feeling that it wasn't clear enough. We've put out clarifying language in a number of press conferences, as well as I think the actual order has been shared with folks and is being communicated on. I am talking with the state about other potential items to add, other venues that may benefit from that. So stay tuned. I'm not able to comment on that at this point because I don't have confirmation, but we are actively exploring other potential spaces that may qualify and benefit from similar provisions. I think the second component was around testing capacity. Our third VEEP site testing is today. We have trained additional staff to be able to offer testing and made some provisions within the schedule that we hope to be able to test up to 100 people each time. In addition to that, as I referenced yesterday, I was literally typing the email as the Zoom invite came through, we're looking to create this mobile, how to address the issue of access for folks who don't have a provider in terms of getting that referral. And so we are trying to get the details in terms of working out potentially a mobile hotline that is staffed by a provider, a clinician, who can triage an individual's symptoms and be able to order a test in the system. That could utilize our VEEP testing sites, as well as we're working on exploring some other potential venues that could absorb some of that testing capacity. There are some conversations around working with some additional vendors and identifying others who may be able to provide testing capacity beyond our current relationship with Quest and LabCorp. None of those conversations have been finalized. We have requested information to be provided from those who have discussed. We've discussed that with, and our contracts team is reviewing those to provide feedback. I think the third component to talk about and discuss is, as we discussed yesterday, the data component. The governor, we won't rehash that, but that was released or partially released on Sunday. Our chief epidemiologist has completed an up-to-date map of the county to provide information on incidents by zip code. We are not putting out the specific numbers, but however, consistent with other jurisdictions, including Baltimore, Chicago, Anne Arundel County, and other places, we are using a color-coded map to give folks a sense of the ranges of incidents in each of their particular zip codes. In addition to that, we are continuing to break the data down by gender and age. We still do not have complete data by race from the state, and a new graphic that shows cumulative incidents as well as daily incidents. The last data piece to mention is folks have talked about what we're looking at, how we're measuring our surge and our peak. There are some models that suggest that our peak will actually happen within the next week. And by peak, that means just our maximum, the maximum number of daily deaths and cases to experience. And then, not to say that we won't have new cases after that. It's just the maximum number will be experienced on date X. And so we are, our statistician, our EpiConnect at University of Maryland, who's also utilizing the University of Washington model that many jurisdictions are using, and is actually the model and expertise that is informing the state in terms of their predictions, is compiling our numbers. We've just sent the most recent ones to him, and he's working on that, and we hope to have more information on that this afternoon. I think that hit a lot of the points that you had asked me to comment on. I will stop there in the interest of time for Dr. Stoddard to give his update, and as always, happy to answer any questions.
Thank you very much. We do have a couple questions, and I'm going to ask my colleagues to be very quick in their questions for you, Dr. Gales. The first is Councilmember Jawando.
Thank you, Mr. President. And thank you, Dr. Gales, Dr. Stoddard, for all the work you're doing. Two quick questions for you, Dr. Gales. One related to the disparities work. I know, as we've discussed, many of us, this council sent a letter to the governor. Some of the information was released. The zip code information was released, which can be correlated to race because we know census data and we know that, but it's not, as you've said many times, that doesn't necessarily serve as the only proxy for race. When you say that you don't have the data, complete data for race and ethnicity from the state, could you just talk about that and what you're doing to help address that situation, either with the state or with the information we have here, in light of the other steps you're talking about with pop-up testing and trying to get people who have referrals, who have trouble getting referrals? Could you just talk about that in that context, please?
Sure. Well, to the first point in terms of the access to the data that was released by the state, and as we talked about it yesterday as it relates to zip code, is in a rush to release data, is it actually complete data? And so, for example, when looking at I think the state data that's been released on race is maybe for, I think, 75% of the cases. It's not for 100%. Right. And there's a lot of data missing on race. And in fact, I think it's only Black, white, and other. Right. So again, it's difficult to extrapolate from that. Now, what we're trying to do is, as many of you all are aware of our previous analysis that broke down the status of health by zip codes in the county, we are trying to use those measures to overlay on incidents. And then also, once we get more data on the fatalities within the county, to try to see if there's any relationship we can draw between race, specific location of housing, type of job, that kind of stuff, in terms of folks who are coming up positive, and then also any correlation with those who are dying, to see if there's anything that correlates with the negative and adverse outcomes. The information that was, and even in releasing the zip code data, we don't have specifics to say, of the 1,800 cases in Montgomery County, we don't have a breakdown to say 40 of them worked as construction workers, 70 of them worked as teachers. Right. And so we're trying to piece together as much as we can to see if we can find any causal relationships that point to easily identifiable areas that we can implement interventions to address that specifically target those groups. Now, taking a step back, there are some other actions that we are looking to take. For example, I think that increasing testing capacity will be significant, because even in these numbers where we get the zip code information and we put the daily totals up, that's an undercount, because we know everyone's not getting tested, and that doesn't factor in the number of people who may have been advised to stay at home and quarantine without actually getting tested. Right. Right. So those are the things we're working on. I think there are a host of other things that could be explored. I think that given that a lot of communities of color in particular are benefiting from the social support network through our nonprofit agencies, I think that creates an opportunity for additional support there. Yeah. I think there are, in terms of recovery related to health, I know that we've talked about in previous conversations with the council overall, how we can build a better social support network to address social determinants for chronic disease management. And I think there may be some creative strategies. Again, just throwing out ideas. I know that the New York Times had a great op-ed over the weekend that discussed how to address health disparities in the context of COVID-19, as well as create substantial structural changes in the future. And I think, that introduces some ideas such as microloan programs that work. And I'm just throwing these out there, so don't hold me to it. I'm just throwing out ideas to be able to invest in folks so that they can get their social support needs met in the interim. Because again, we know that so many of those social determinants impact their health outcome, whether we're talking about their chronic disease or outcome related to COVID.
I appreciate that, and thank you. I know we've been in conversation, and Councilmember Navarro, who I'm sure will speak here, and I live in the second highest zip code in the state with the most cases, and we're working on an effort on an appropriation to implement some of the things you discussed and some of the things that have been in the New York Times article. And so I'll be talking to my colleagues over the next week and appreciate the dialogue on that. The other quick question related to the grocery store and safety, and you mentioned the face covering, it's a larger issue. We have postponed action on the bag tax suspension. The underlying issue there was that as we head into the curve, we're trying to limit contact with any potential vector or any thing that could spread the disease. I read an article the other day about people's shoes. I mean, so there's a lot of things out there. And so if you could just comment about the reusable bags. I know you've given guidance on, again, and my proposal would not eliminate the ability to use them, but it would just incentivize and not penalize people who didn't feel comfortable or weren't allowed by stores who have taken steps to stop the use of the bags. I know you've issued guidance on how to clean and how to safely use them. Could you just comment on the bag issue in that context and potential health benefits and precautions that people can take?
Well, I would say I would just reiterate what we've mentioned before in terms of I think there was a peer-reviewed article that looked at it. There is not a ton of evidence that gives a clear picture of what the risks are. Quite frankly, in public health perspective, I think it would carry minimal risk in comparison to some of the other things, such as wearing a face covering or coughing on your hand and touching items that way. And so our, from that perspective, our energy has been, recommending folks to say, we don't know what the risks are. We think based upon what we know, it's minimal. But if you're going to use it, here's how to properly use it. I know in some cases they've talked about how grocery stores, if you do bring your bags, and that's actually how we shop, you can, bag your own groceries. If you're going through a line with a cashier or if you're utilizing self-checkout, you can use that space. And I know that a lot of entities, at least in the last couple of times where I've gone out shopping, whether it's been at Target or Safeway or Whole Foods, have actually cleaned the site where I've used it and had the bag after each person uses it. So I think, I say all that to say that, the risk is unclear. We think it's very minimal. And so we're educating people on that you can use them. This is how to best use them in combination with making sure that the surfaces are clean, again, which is what we've recommended from the very beginning.
I appreciate that. And I look forward to continuing that conversation as we head to the passage or the consideration of the bill. Thank you very much, Mr. President.
Thank you. And we're at 11:56. So please, we are under a times constraint. Councilmember Raymer.
Thank you. I just wanted to ask about Dr. Gales, the correlation between peak of hospital usage and peak of transmission in the community. I think our community is unclear what it means about peak usage, and you sort of mentioned a few points. Can you just talk a little bit about what you mean when you talk about peaks?
So you're right, there's multiple terms, and actually it underscores why we've been very careful about how we speak about it in public. And in terms of rushing to say, yay, the peak of transmission is tomorrow, because we recognize people will say, oh, well, if the peak is tomorrow, then after tomorrow, we're fine. So there are two different terms. So there is the peak of transmission, meaning that based upon models, based upon the numbers, we think that might be the greatest burden of disease or new cases at that point. Now, the peak hospitalization rate is a little bit different. So as you can imagine, even if we experience a peak in the number of max the maximum number of cases on a daily basis, there are people still going to get sick every day. And so part of that is informed not only by the numbers that come in, but the quality of illness and the percentage of people requiring hospitalization. And that one we don't know. To date, the percentage hospitalized has been somewhere between the 20 and 25% range. And so that stayed constant. As number of cases have increased, we've seen the fatality rate increase. I think it's now at about 3% across the state. So those two factors, more so than the maximum number of cases on a daily basis, will drive the hospitalization surge unit. So I hope that explains the two different components and how we look at them together, but also look at them separately.
Thank you. I want to thank you for your order on masks. I really appreciate it. I do think we should look at buses. I think in that enclosed space, I'm concerned about that, but thank you for taking quick action.
No problem. And we are looking into that. So hopefully I'll be able to comment further soon.
Thank you. Councilmember Navarro.
Thank you, Dr. Gales, and thank you, everybody. And I quickly just, in the interest of time, just wanted to request that perhaps we try to schedule an actual session item on the issue of disparities. I believe that although we are right now, being very proactive and standing up some teams to begin to work on what could we do immediately, I'm also aware that, as you have said, Dr. Gales, most likely as we start getting more data and more testing, I worry that, of course, we're going to see other kinds of increases in other parts of the county that we know are predominantly of color, and also that has a disproportionate amount of people who are low income. And so I think having some kind of a template where we can very quickly go on a checklist and look at issues like you were mentioning, for example, microloans. We have a microloan program or other kinds of, emergency cash assistance, because there are so many ripples in terms of the impact, not just on the health, but also on the economics and the, self-sufficiency issues. But it would be nice to have some kind of a template that we can quickly, deploy. And I do look forward to the team that is going to begin to do that work. And I know some of my colleagues have already started to have conversations about it, but just wanted to request a formal actual session item so that we can, address this in a much more holistic fashion. Because although right now, yes, it's, 20904, 20902, 20906, which are, 20904 is where I live, but is also, I think, split between District 4 and as well as District 5, Councilman Hooker. I think we can expect that we will also see other zip codes with similar demographic makeup and characteristics also beginning to see that surge. So anyway, thank you all for everything that you're doing. And again, I look forward to continuing to work with you to continue addressing, this very unprecedented time. Thank you.
Thank you. Dr. Stoddard, please.
Thank you. And I'll keep my comments brief because I know that Ms. Parker and Ms. Hartman or Mr. Hartman are here to provide updates on the public messaging side as well. So a couple key things I want to update on. So effective yesterday, Fire Rescue activated phase 1 and 2 of their pandemic surge plan, which essentially puts more advanced life support and basic life support units out on the streets 9 to 5 every day. They deployed decon units to each of the 6 hospitals, assigned an EMS officer to the 911 center, and have deployed additional mobile integrated health units into the field to allow them to respond to what, as Dr. Gales referred to, we expect to be the surge this week. As it relates to personal protective equipment, we've given updates on this many times before, and I think it's important to continue to do that. We are in a bit better shape than we were a couple weeks ago. Obviously, we've received a huge number of donations. We've also had some success in getting some orders in and had some resources provided by the state to us, which is great. We're getting since Friday, we've gotten 75 requests for personal protective equipment from healthcare providers, non-healthcare providers in Montgomery County. Those include nursing homes, assisted living facilities, and in-home care providers, pediatric providers, and the like. We provided 2 weeks worth of personal protective equipment to the nursing homes and assisted living facilities on last Wednesday and Thursday, so they are in good shape this week. And given what we expect to receive in terms of shipments from the state tomorrow, as well as a shipment that we're actually going to pick up in Pennsylvania, tomorrow. We're expecting to be in fairly good shape to be able to resupply them going into next week. There is both an online ordering process, which is on the COVID-19 website, as well as a paper variant that healthcare providers can make requests of for personal protective equipment. And we're considering the HHS equity process in distributing that PPE, moving forward. We have distributed face coverings to county staff and employees. We recognize that those initial face coverings are meant to be, they're not sturdy enough to do for long-term use, and we're going to continue to replace those as we receive additional sturdier, more reusable face coverings. We started receiving those a week and a half ago. We can receive about between 1,000 and 2,000 of those a week, and we'll continue to replace what we provide to our county staff during this period of time. I do want to highlight, because I think it's really important to understand, we've received a ton of donations and volunteer efforts. It's really important that, our community has really stepped up on this. There's a group called Milko Mask Makers, which are, essentially a community group that is essentially producing face coverings and providing them free to nursing homes and other food providers, other partners that are in need of those masks. And so it's really important. It's really great that our community stepped up in the way that they have to provide that support. We're receiving donations of materials, fabric, masks, etc., through our Dennis Avenue Health Center, as well as the public safety headquarters. We have schedules to cover essentially Monday through Saturday to receive donations in various locations. I briefly want to touch on a couple things that we haven't talked a whole lot about, which is, a couple things that we have talked about, and then I'll talk about one more thing that we haven't talked about. So, Food Security Task Force, we stood up last week. There was another meeting this afternoon. Dr. Crowell and I participated in that, as well as the Food Council, others from HHS and Emergency Management partnered together with the nonprofit community to address food access issues. We've seen significant increases in food access requests, and we want to make sure that we're staying on top of those and responding to surges where we can, as well as ensuring the protection of food workers who are in our nonprofit environments, make sure they have the hand sanitizer and other supplies they need to be able to safely provide the food to our residents moving forward. I expect that after today's meeting, they're going to produce a short-term needs report that'll help us inform us on how we can move forward with providing resources to the community. We've gotten questions about 311 recently. I think it's important. I want to go over that real quick. So roughly 311 calls COVID-related are about 9% of our volume as of yesterday. That's pretty consistent over the last week, 9 to 11%, which is down from 15 to 20% the previous week, which is, that means the messaging is getting out there. There were 15 calls yesterday related to the new health order, meaning that there is some questions that have come up from the public about the mask order or the coverings order, but not a insurmountable level of interest there. Calls continue to focus on service modifications, ride-on and solid waste. We have seen, particularly in our Spanish language queue, an increase in requests related to manna and other food access issues, which is again supported by what we're seeing in the Food Security Task Force. And so that is an important thing for us to understand. We are seeing that increase in need. Finally, I want to talk about two things we haven't talked about. So our Emergency Support Function 14 community recovery has been stood up. What that looks like is we're trying to make sure that, as I think Council Member Navarro said during the interviews for the new Assistant Chiefs for Police, Montgomery County will look different after this is over with than it does today. Well, certainly than it does today, but certainly than it did before this event started. And we need to recognize there are some things that will be done differently, but there are also some opportunities for how we can do things better. And we want to make sure that we're learning those throughout, even as we respond. The response is not over, it's not close to over, but we have a responsibility to our residents to learn the lessons today that we can apply for the future in terms of how we can iterate on our process in the response, but also make modifications, both in terms of health disparities, how county government operates, how we deliver services in the future. And so we're standing up our recovery function to make sure that we're learning those lessons now and can record them in a way that allows us to make real substantive change after this is over with. Finally, the county executive is today signing the CARES Act request submission through the Department of the Treasury. That will entitle Montgomery County to $183 million plus dollars in support. We are told that there will be some additional guidance coming on April 24th about how we can actually utilize those dollars. Right now, it's essentially, non-budgeted items related to COVID-19 response. But obviously, if we can get into the realm of economic impact, we will blow through that 183 very quickly, thinking about the economic impact on our community and our residents and county government. But obviously, we need some more guidance on whether that is an applicable use of the funding as well. So more to come on that. I will stop there.
Thank you very much. Councilmember Rice.
Well, thank you very much, Mr. President. And so my question is for Dr. Gales and for Dr. Stoddard. The first one, very quickly. For resource leads, we've all been getting resource leads. Who should we send that information to? For example, folks who say they have connections with ventilators, masks, et cetera. Who should we send that information to?
You can send it to myself and Ash Shetty, our procurement director. We are working jointly together for anything that's a pre-procurement or acquisition of resources. If there are donations, certainly we have a donations team that's set up, but you can send them to me and we'll get them in the right place. Myself and Ash will work together.
Excellent. Then just one other quick one, and then one for Dr. Gales. Mask compliance, we've already started hearing complaints in the zip code 20904 at Home Depot, Silver Spring, to where folks weren't adhering to the guidance of ensuring that folks have masks. As we get more of those concerns, complaints, who should we send those to?
So those complaints can go through, they're directed to the Licensing and Regulatory Service team, so they can call 311. Those complaints are, they are taken and a written documentation of it, and then it's forwarded to the Licensing and Regulatory Services team to do an investigation. I will point out that our team yesterday did some random check-ins in places to see how compliant people were. And so that's the way people can get that information in, and our team will do the follow-up assessment.
Excellent. And then my last question is a little bit harder for Dr. Gales. Of course,
I can't hear anything.
Yeah, you're off again, Craig. We're gonna move on then, and as soon as Craig gets back on, we'll let him ask his question.
No hard questions are allowed. That's what the computer.
Yeah, that's exactly right. Dr. Gale's got his wish, Craig. That's what that was. While we're waiting, Julie Parker, would you like to give us an update?
I'm sorry about that.
Oh, you're back. Okay.
Yes, I'm back. I'm sorry.
We had a lot of nice things to say about you while you were gone.
Yeah,
So go ahead, please.
I'm sure.
Yeah.
Dr. Gales is like, great, I get off the hook for the hard question.
That's exactly what he said. Yeah.
Dr. Gales, and I'm going to say this quickly. Our schools, we're trying to make a decision now. We're nearing the end of April. I know that you said that we appear to be getting close to flattening the curve. Does this mean that we can look at reopening our schools, or is this something that still signifies a significant risk to our community and we should retain not having people in groups together? Obviously, you can't have schools to where you have 6 foot distancing, all those kinds of things. It's just not possible. So from that perspective, is it realistic for us to expect schools to open anytime soon?
I think the reality is it's not realistic because even if we do see evidence, kind of extra to use last week, I think there was a day where we saw only 300, I think it was like 375 new cases, and we're like, oh, this is a significant departure from the increases of like 500 and 600 the previous days. And so we caution folks to say, let's just see how many data points we get. And the next day we had the worst day. We had over 1,000 new cases the following day. So even if we do see evidence of a flattening of the curve or a peak and a turn in the opposite direction, it's going to take it's going to be a significant amount of time to continue those practices of social distancing and sheltering in place to make sure that that flattening of the curve has fully happened. So the reality is I don't think it's realistic to expect any changes in the schools opening at this time.
Thank you, Mr. President. Thank you, Dr. Gales.
Thank you. Councilmember Navarro, did you have a question?
Thank you, Dr. Stoddard. Well, first, in terms of the comment you just made regarding the post-COVID-19 world, you're absolutely right. And we definitely will have very many different categories that we will have to examine. And those conversations have begun as well. I know some of my colleagues have already begun to talk about other areas other than just the economic reality, but just other areas that you just described. So I'm glad that you're already thinking about this as well. I think that the sooner that we're able to put forth some kind of a blueprint that we then tweak as we go, the better we're going to be, instead of waiting until afterwards. So I appreciate that. Another question in terms of like referrals. So I think I may have sent you guys an email. It's kind of crazy, but so I know I was approached by some county residents who have worked on, there's a particular doctor who lives here who has worked on technology and things of that nature. I think working specifically with nursing homes who are at very high risk levels, and wanted to connect with you. What is the best way to connect those folks who are eager to help and have particular areas of expertise that could be useful for us, and of course our county residents, which I think is also wonderful. But is the best way to go directly to you, or is there somebody else? I know you guys are so busy.
Yes, so we've got a joint team that's looking at volunteerism opportunities, and that includes both our Medical Reserve Corps, our Community Emergency Response Team, CERT team. And so depending on what the skill set of the person who's looking to volunteer, we can provide different opportunities and talk through exactly what their skill set is most applicable for. But I think the best place to go would be, so Netta Squires on my staff has been really helping to coordinate the volunteering opportunities. If she can't help directly, she'll get whomever it is in the right place. And so you can copy me as well, and I can help as well. But certainly we've got a team looking at volunteer opportunities in partnership. She actually sits full time at the Dennis Avenue Health Center Command Center, coordinating with HHS and emergency management to make sure we get the volunteers in the right places.
Great. And I don't know if this is a volunteer specific issue. I think it was more about some technology that may be available. So if it's something like that, would Netta be the same person that she can discern who to go to?
Yep.
Yeah, that's right. We can figure out exactly. We've obviously had opportunities that are both business offer opportunities, as well as we've actually had a few research studies that have been affiliated with universities, and so we'll route them depending on what the nature of the offer is of support. We're trying not to turn away any offers of support across any opportunity. So certainly we can get in the right place.
Thank you so much.
Thank you. And let me just say that I actually had communication with Netta Squires yesterday, or I think it was yesterday, it might have been the day before. And she's certainly very, very efficient, and I know that she's doing a wonderful job. Councilmember Albanese.
Thank you. I just had a couple of quick questions. So we have been getting some constituent concerns regarding businesses that are in fact non-essential, but that are making their employees go to work. Who should they call but they're afraid to lose their jobs? Who should they call, Dr. Stoddard, to report something like that? And what recourse do they have available to them?
I think Dr. Gales can actually probably answer that. There was an order put out by the governor's office last Monday, I believe, allowing the health departments to enforce those orders. Dr. Gales, I think you can.
I think I'm unmuted. So yes, if there are folks, again, you can refer them to us. And we do there were extended orders or powers, so to speak, that the governor has conveyed onto health officers to be able to implement penalties as severe as being shut down indefinitely if there is failure to comply with the directive.
Thank you. I appreciate that.
And we can keep those anonymous so that if people wanted to make a concern or a complaint without being identified for fear of retribution, that can be arranged as well.
Thank you. I appreciate that. And Dr. Gales, for people whom are concerned they may have the virus, testing is obviously still an issue as we wait to get tests. But what should we encourage people to do that have it? I assume it's still drink a lot of liquids, rest, do all those things that you would normally do with any other virus, or there are other special things that people should do if they are concerned they have it? Is there something that has been proven to be more effective to help with some of what people are experiencing?
You pretty much directed. I mean, it's supportive care. Unfortunately, there is no treatment at this time. And I want to be clear that although I know folks who are a little bit further south than we are recommending hydrochloroquine, that is not an effective treatment measure and one that we don't recommend. And we hope that if there are folks who have, if you have evidence that there are myths related to that in the community, please let us know, because we want folks to be very clear about the risk of using that drug, one for themselves, but also in taking away medication that many who have autoimmune diseases require and need for their treatment regimens. So it really is supportive care, making sure folks get rest, they stay hydrated, those are the big things. And if there is any significant change in their conditions, so for example, if they have increased shortness of breath, to seek medical attention, because then if their symptom course is worsening, the sooner they can get seen by a doctor and get some increased supportive care, that may help offset the severity of their symptoms over the period of time.
Thank you both.
Thank you. Julie Parker.
Good afternoon, and thank you for allowing me to appear before you. And I also wanted to thank you all for your leadership. First and foremost, as a Montgomery County resident, it is remarkable to be on the inside and to be able to watch the level of dedication across this government and the amount of manpower and man hours that have gone into trying to manage this pandemic. Your diligence and your concern over meeting the needs of this very diverse community, it's noteworthy. And in part, out of that attention to the needs of our very diverse community was born our Special Populations Communications team. I'll touch on that in a little bit, but that team, who is headed up by Ken Hartman and Diane Vu, they work closely with us on the COVID-19 communications team to strategize about how best to meet the needs of so many in our community, what messages will resonate more with others. And so we are tied at the hip, joined at the hip, as we try to communicate so much information. Media relations and social media, as you know, is a 24/7 job. And many of us have been working close to that. So I've passed along for you a one-pager for your reference, and I'll just go through that. I won't dive deep or too deep into the numbers, but I felt that these specific examples might help paint the picture of what we've been working on. So I mentioned Ken and Diane's team, and the COVID-19 team works closely with them to translate news releases, to create graphics that will resonate with the community, all communities. We try to make these as simple as possible and have these graphics be another tool to help people easily digest information. Not everyone has the time or the inclination or the means to read a news release, for example, or to watch a 10-minute video, but infographics are a great way to reach all sorts of communities. So we've paid a lot of attention to that. On our website, and I believe, I don't want to speak out of turn, but I believe this is the most robust time in our county government's history in terms of reaching such a broad audience. So there are communications that are posted on our website in Spanish, French, Vietnamese, Korean, Chinese, and Amharic. And all of that falls under Ken and Diane's team, and they will speak in detail, but I just wanted to give you broad strokes on that. The COVID-19 communications team is responsible for, among other things, news releases. And we captured a window between March 12th and April 7th, where we put out 84 news releases related to COVID-19 information. 50 of those are in English, 34 of those in Spanish. Again, working closely with Ken and Diane's team, they decide what information should be translated and into which languages. But 84 is a noteworthy amount of information to send out to the media and beyond just the media. This is as always, a broad communications effort is meant to reach the media, who can then amplify our message to their tremendous audiences. But at the same time, we're also reaching the very active and engaged and interested Montgomery County community. I believe on our media distribution email list, there are some 7,000 people. So this is county government employees who have signed up. These are community members who are just interested in the content that we push to the media. So we are reaching a big audience, and more to come on that. Our COVID-19 updates newsletter now goes out twice a week, Mondays and Thursdays. We've had 9 of these newsletters go out between March 15th and April 10th. Each of those newsletters, on average, reaches about 380,000 recipients. It's tremendous reach. Initially, that newsletter was branded as the paperless airplane. It's something the county had established long before this pandemic. We rebranded that so that people who saw that in their inbox would see COVID-19 updates and knew to open that to get anything related to this world health crisis. In doing so, the change prompted the open rate to jump from 23% to 38%. And that is a tremendous way for us to reach the community. And it covers a whole host of things, from messages from leadership, from where people can find meals, school updates, the health order, how to create a face covering for when you're going to the grocery store. There are videos there, graphics there, news releases in there. We're also handling a tremendous volume of media inquiries between news releases, news conferences, media briefings, virtual media briefings, virtual community briefings, 2 of which we have this week. We're speaking with the media tomorrow, and also another community briefing on Thursday. All of that has generated approximately 200 national and local media inquiries that we have handled in this 4.5 or so weeks. Our social media accounts have also a tremendous reach. It's a way that people can communicate directly with us and us to them. Since this started, over the last approximate 30 days, the Montgomery County government's Twitter following has jumped by about 3,000. The Facebook page following has increased by about 5,700. Facebook page likes about 3,800. And then Nextdoor, which is an app that many people use, and it's neighborhood specific. It's sort of a hyper-local platform. The amount of people there have jumped about 6,000. Again, this is over the course of 30 days. So there are a multitude of ways that we are reaching various segments of the community. And then finally, in part, the COVID-19 communications team helps to populate the county's web pages. There is a COVID-19 dedicated page, and we help to feed that content. It is a work in progress to help make it more easily navigated, to help people figure out where to go, how to find what they probably want most. Many of you may have been on that site and seen the state demographics and statistics coming from the state. We will this week have Montgomery County generated content, maps, that is focused on our community specifically. So stay tuned for a news release on that. And I think I'll leave it there for the Special Populations Communications team.
Thank you very much. Before we go to Ken Hartman, Dr. Gales and Dr. Stoddard, if you have to leave, we understand. We know that everyone's a little busy, so we do appreciate it. And Ken, it would not be a reflection on what you have to say if they have to leave. So anyhow, Ken, would you like to speak, please?
Sure, I'll be brief. I sent in a 2-page summary for all of you to review. There's a lot of work. It's been a whirlwind of activity over the last, 5 weeks, 4.5 weeks now. But some four basic highlights that we're that we're working on, and we are working on under the principle that when we come out of this, our systems need to be better than they were before. As Dr. Gale said, substantial and substantive changes need to be made. So with that, with everything on those 2 pages, we are looking at evaluating and growing our networks, not just to have people on a list, but to have effective networks that can then relay information, particularly partnerships with our community organizations. And I want to thank council staff for helping us reach out to a number of community organizations that in turn communicate with populations. The second thing is improving that translation capacity. We have stood up a team of 20 county employees with advanced skills. Pretty much the entire list of folks who get paid for their language skills are on this translation team in 6 languages. But we are also looking at other models from other agencies and other jurisdictions that should be the end result when we end this. We need to maximize our social media. We stood up the WhatsApp account in Spanish. It's been very popular. The membership is growing. And that serves as an example that for each of our populations, everyone has their own platform that they prefer, and we need to be on those platforms. And then the last thing is this local messaging and relevant messaging. We spend a lot of time translating a lot of material, and sometimes it's just the simple, short, easy to understand message is the best way to communicate. And we're on those 2 pages. I have some of our challenges that we're working with. As everyone knows, we're working we only have so many people working on so many things, and so expanding that bandwidth to avoid bottlenecks. So we've brought on a graphics artist to help us produce graphics in multiple languages. We're opening up the new social media channels, and we're looking forward to partnering with the county on the channel that on Facebook that we've been talking about. Messaging, I talked about that. And the last thing is something we all know, the barriers. We need those partnerships with our community associations so that we can, there's somebody who can aid our populations. We're working on this with the business grants and nonprofit grants, where not only is the county a resource, but we're talking to the Ethiopian Community Center and to the Chinese Cultural Association to have them be able to help us help businesses in languages where they're more comfortable. And then lastly, diagnosing the bottlenecks. There have been several occasions when we've looked at something, and then when you look further at the numbers and the websites and so on and so on, you see that our system is not 100% accessible. So diagnosing and tracing back where those barriers are is a continuous project for us. So I'll stop there. I do want to give a shout out to Councilmember Navarro and her staff, who've been fantastic. I mean, the WhatsApp was a great recommendation. I know the embassies use it and they use it very well. I also want to thank Councilmember Albornoz for recording some messages that we'll be sending out on social media and to radio stations, because on the weekend the news in Spanish isn't there, so maybe we can have Gabe's voice there instead. But I want to thank everyone for their support. I'm happy to answer any questions.
Thank you very much. Councilmember Navarro.
Thank you. I'll be brief, but really don't want to miss the opportunity to congratulate Mr. Hartman and the team, Julie. Everybody has just, come together so quickly to take on, once again, an unprecedented task. I have to also acknowledge and thank Carolyn Chen and Lillian Mass with Sonia Healy leading that team, and of course, many of our own staff on council offices. Berta Sersosimo has done a lot of great work. This is what it takes. And, working with Councilmember Albornoz from the very beginning, we knew that we needed to kind of organize this a little differently. And it was just I think, wonderful to very quickly, as we started to put a list together, we were able to come up with a really strong team. And again, this is seamless collaboration. This is not a council thing. This is not an executive thing. This is county government coming together very, very quickly. And I can see the impact. I mean, it is definitely evident. And so, you know, as we also continue to do this post-COVID-19 work, the only thing I will say very quickly is that, you know, we don't have to look too far, because I think MCPS has done an amazing job with how they communicate. And way back in the day when I was on the Board of Education, I helped set up the translation unit. That's been a real asset. So I would just suggest that we, you know, look at that carefully, because what we are learning here is definitely those gaps, and we've been able to fill those gaps quickly. But we should do this as just a matter of course, you know, from now on, regardless. But thank you so much. Very critical, especially when we talk about the disproportionality information that we just got from those zip codes. You know, information is key. So I know all, you know, some of us are going to be working specifically on that issue, but I'm glad that we already have this infrastructure that has been, you know, already stood up for this kind of work. Muchísimas gracias a todos.
Thank you all very, very much for being here. We're going, and we sincerely appreciate all your help.